We are one of the premier clinics within UK, both for our success rates and the techniques and the technology we have on offer. In this mystical, biological and technological process, we at New Life Clinic offer you a vast variety, a range of fertility assessment and assisted reproduction. We also do specific treatment for couples with recurrent IVF failure, implantation failure, or recurrent miscarriages. We provide immunosupportive therapy based on the immunological results of the individuals. The primary requirement for a successful treatment is a good clinical assessment and a laboratory quality. We have a state-of-the-art laboratory and which is equipped with latest technologies and equipment, which includes time-lapse imaging, facilities to do ICSI, which is micro-injection of the sperm, doing biopsy for procedures like PGT, which is pre-implantation genetic diagnosis, or PGS, which is pre-implantation genetic screening, whereas we screen the embryos for aneuploidies before putting them back. And also facilities for egg freezing, embryo freezing and storage. Our embryologists are very experienced and use specialized media like embryogen and embryo glue for the wherever indicated. Our staff has been extensively trained and has been working in the field of fertility for over many years, and therefore are highly experienced in providing treatment and care. We have obsessive involvement with our patient care, and we believe that no one treatment can be suitable for all the couples. We do a good clinical assessment and tailor-make the treatment process for every individual or couple who approach us with a delay in fertility or for fertility preservation. Our primary clinical assessment involves assessment of the sperm quality, assessment of the ovarian reserve, and assessment of the uterus and the fallopian tubes. For assessment of the sperm quality, along with the normal sperm analysis, we also provide sperm DNA fragmentation. For ovarian reserve, along with the traditional transvaginal scan to count the number of follicles, we consolidate our finding by doing a blood test looking for anti-Müllerian hormone, which is produced by the ovary and directly indicates the fertility status of a woman. For checking the uterus and the fallopian tubes, traditionally it was done by a procedure whereas you put in a dye and take X-ray images to see the fill and spill of the tubes. However, now we're using the latest technology by performing an ultrasound-based procedure called HICOSI, in which we can also assess the uterine cavity along with the testing of the patency of the tubes. In a good clinical assessment, it is mandatory to understand why there has been a delay in the fertility of that couple. So once we've done our assessment based on the sperm and the ovarian and the uterus and fallopian tubes, we therefore then make the decision of what kind of treatment is the best suited, whether it is IUI or IVF, whether it is with the partner sperm or with the donor sperm. Once treatment has begun, a very close monitoring of the ovarian response is essential for fine-tuning the treatment and for optimal results. From the laboratory perspective, our obsessive assessment, obsessive evaluation of the processes and the quality control gives us the final excellent end results. All these parameters together makes New Life Clinic a clinic with a difference.